Welcome everyone to the annual GIM Research Week. My name is Vikas, and on behalf of my team here at UHM, it's a pleasure to be able to share the findings of our mixed method study, which analyzed the perceptions of patients and nurses regarding the use of wearables in inpatient settings. There's been a growing body of literature in the past decade examining the role of wearable devices to monitor in patients, but a lot of these studies have been limited by large dropout rates and issues with patient adherence. So the objective of our study was to highlight some of the key barriers and facilitators involved in adopting wearable technology in acute care settings. We were curious to hear from patients and clinicians as to what they thought. So the methods of our study really involved in recruiting 50 hospitalized patients from GIM units at 2 teaching hospitals. We asked our patients to wear the Fitbit Charge 2 or the Charge 3, and they provided their feedback through structured questionnaires. Some of the elements of the questionnaires are listed on the right-hand side, and the left-hand side is the inclusion and exclusion criteria. Of the 50 patients that we enrolled, 39 filled out the questionnaires. In terms of the demographics, the average age of our patients was 72, and the wearable was typically worn for about 3 days, which is consistent with what we found in the literature. Both patients and nurses had the perceived accuracy of the wearable's ability to measure heart rate, sleep, and activity was actually quite high. It was rated at 8 out of 10, approximately. And then table 3 is the feedback that we compiled from the patients. We had a 78% response rate. And as you can see here, there's 4 main themes and there's prototype quotations that we received from patients. But a lot of the feedback was centered around device comfort and device design, as well as patients feeling that the wearables helped increase their self-efficacy as they were able to match the daily step target or sleep more to be able to optimize their health practices in the hospital. The nurses also provided some valuable feedback. We had a 60% response rate, and their feedback centered around using the devices in more acute care settings, such as the ICU or cardiology wards, where we need continuous monitoring. And they also felt that additional features, such as blood pressure monitoring or oxygen saturation, would yield valuable data for clinicians. So in essence, our clinical study did suggest that wearable devices showed promise in monitoring inpatients. The significance of our study was that it helped identify some of the key barriers, such as wearable design, functionality, and clinician training. It also helped identify some of the facilitators, such as clinician endorsement and ability to enhance digital self-efficacy, which really drove our patients to wear the devices. Our study is limited because we had a small sample size and it was difficult to obtain physician feedback. And so future work should really incorporate stronger methods such as interviews and focus groups to have a more robust analysis. That concludes my presentation for today. I want to thank you for tuning in. And at this point, I would like to welcome any questions that you guys may have. Thank you.